So we're going to address the topic of the SI joint, which is everyone's favorite topic, but what I'm going to talk about is possibly how not to manipulate the SI joint, meaning how to screen the SI joint and then determine whether it is or is not involved. Recent research in the JOSPT says if you do these clusters of tests, you only have about a 32% chance of the SI joint being involved. But if you do this cluster of tests and they're all negative, then you're 92% sure that the SI joint is not involved. So there's better confidence with the negative aspect of these tests. Now the qualifier will be that there are special populations where the SI joint does have some impact. And those are people who are hypermobile, so a high Baton scale, and people who are pregnant. Those are the most common causes outside of trauma. So what we're going to do is just quickly go through those cluster of tests, and then we're going to move on with some clinical reasoning and looking at areas that may in fact be more impactful with pain in this area, and that would be a restriction up at the TL junction or a restriction in the hip. Those are high value areas because they move more than the SI joint, where there's questionable and long debates on whether that joint actually moves or not. So we're going to start and look at the cluster. So I'm going to have you lay on your stomach first. So one of the tests that's part of the cluster would be the sacral thrust. So you just get your hand on the sacrum and you're pushing superior. Now the hope is you're just taking the sacrum and pushing it up into the joint. So you're trying to reproduce pain. There is one test that's outside of the cluster. There's a long dorsal ligament that comes down from the PSIS onto the sacrum that tightens with counternutation. And sometimes in these special populations, if the patient is pointing to their SI joint, that's called Fortin's sign, and you palpate right on that area and counternutate the sacrum, and it reproduces their pain, that actually may be the long dorsal ligament, and you can end up frictioning that ligament, and it does respond pretty well. With the qualifier, you still have to look at the hip, still have to look at the TL junction. So that's the sacral thrust, and then we added counternutation for the long dorsal ligament. Now I'm going to have you lay on your back. The other test is we're looking at compression and distraction of the SI joint. If I get on the ASIS on both sides and I push the ASIS together, it gaps the back part of the joint or distracts. So we look to see if that is a provocation test. And if I get on the ASIS and push this way, that's compressing the back part of the joint, distracting the front part of the joint. So we had sacral thrust, compression, distraction. Sacral thrust, compression, and distraction. You can do the thigh thrust, where you put your hand underneath, and you don't have to necessarily put your hand underneath. You can put a towel too if you want. And then you push down through to see if that reproduces pain. Gainsland's test, which is essentially scooting towards me. You have one leg off the table, one leg up here, and you look to see if that torsion through the SI joint reproduces pain. The original thought was that if 3 of the cluster are positive, then the SI joint is ruled in as a pain-sensitive measure. Well, what I'm telling you is if you do sacral thrust, compression, distraction, and the thigh thrust, you probably don't have to add that last test. Because really we're only dealing with 32% certainty anyway, and by the time you get 4 and it's negative, then you've ruled out the SI joint and you can move on to other things. So that's the cluster, but also some of the reasoning behind that cluster.